Namaskar, I'm Dr. Amita Mahajan. I'm a senior consultant Paediatric Hematology and Oncology at Indraprastha Apollo Hospitals, Delhi. Today, we will talk about aplastic anemia. What is aplastic anemia and how does it get detected? Aplastic anemia essentially means that your bone marrow, where all of the blood is manufactured, is not working adequately. Blood has three cell lines: the hemoglobin, which is the red cells, platelets, and WBC, which help us in fighting infections. In aplastic anemia, all three cell lines are depressed, so the patients will usually present with a low hemoglobin because of the low HB and low WBC, which will lead to repeated fevers or non-healing infections, and they may often present also with bruising, bleeding, or tiny red spots on the skin, which are known as petechiae, and these are secondary to low platelets. What are the symptoms of aplastic anemia and who gets it? Aplastic anemia, as I already said, can present with anemia, present with infection or non-settling fever, or it can present with bleeding and bruising. Who gets it? Anybody can get aplastic anemia. The incidence is actually much higher in our country compared to the Western countries. When it happens in children, we often have to also rule out that they don't have a condition which is there from birth, which is known as constitutional or heritable bone marrow disorder syndrome. There are a number of conditions in this category. So, in any children or young adult, if they have these symptoms, we also look for bone marrow failure syndromes. In older patients, there is no hereditary reason, but they can have it out of the blue, secondary to an infection or exposure to some agents in the environment. What are the trends in Indian context? As I already mentioned, that we see a much higher incidence in India compared to some of the developed countries. The precise reasons for this are unclear. Some of it is because of a higher incidence of viral hepatitis in our country, which can lead to aplastic anemia. Another possible explanation what we think may be responsible is that there is a lot of indiscriminate pesticide use in our country. In fact, we see a much higher incidence around the river belts where a lot of agricultural pesticide, excess pesticide is washed out into the river bed, and these are the areas where we see a lot. It can happen in almost any age group, but as I already said, in the younger age group, we also want to look for constitutional or heritable bone marrow failure syndromes. What is the treatment for aplastic anemia? The best treatment for aplastic anemia is a bone marrow transplant. This has the highest cure rate, and if done early before any of the complications set in, it can be an extremely successful modality. So, how do we do a bone marrow transplant? Essentially, it means that because the bone marrow is not functioning adequately, we give some strong medicines or chemotherapy to disrupt this bone marrow and then plant seeds from a healthy donor's marrow. This healthy donor is ideally a fully matched donor from the family, but if no such fully matched donor is available from the family, a donor search can be initiated for finding a suitable match. For those patients for whom we can't find a matched donor, or for whatever reason a transplant is not feasible, treatment is offered with immunosuppressive therapy, and the medicine is known as ATG therapy. This is combined with some other medicines, and together we give this regime for a few days, and about 60 to 70% of children and a slightly lesser number of adults will respond to this treatment. Nevertheless, a successful bone marrow transplant is still the preferred option. What are the complications one can encounter in aplastic anemia? Aplastic anemia itself, like I said, it can present with catastrophic bleeding or an infection that doesn't settle and may be life threatening. If not treated adequately, aplastic anemia will ultimately lead to the demise of the patient, so treatment has to be given. Bone marrow transplant is the most successful treatment, but there are risks attached to that. Even with immunosuppressive therapy, there are risks attached to that. However, as this is a life-threatening condition, treatment under close supervision, regular, under an expert hematologist can still yield very good results. The treatment is so expensive. How does an ordinary family afford this treatment? Today, for treatments, yes, it is expensive, but there is a lot of help out there from government. There is, many, the PM Relief Fund, the CM Relief Fund, there is Arogya Nidhi. A number of government schemes are specially designed to help patients with conditions such as aplastic anemia. Apart from that, there are a number of support organizations and blood donor organizations that will help you fight this disease. So, my only suggestion to families dealing with this very difficult disease is that don't feel hopeless, evaluate quickly, initiate treatment quickly, because the results are best that if we can do the treatment before any complications are incurred, and seek guidance as how to go about organizing funds for this treatment. That can be, yes, it can get expensive, but a lot of support is out there. Today we talked about aplastic anemia, how does it happen, how to treat it, how to get help for treatment. My only last few words to everyone who's dealing with this is that don't feel hopeless. The results are getting better and better. There is a lot of help out there for you. Seek it. And also for all other individuals, it's always our suggestion to stay healthy, stay safe and stay informed. Namaskar.